Hi, good morning, and welcome to our weekly update of COVID. My name is Matthew Wallace. I'm the Director of Public Safety for Brevard County, and I will be your host this morning. Usually sitting in this seat is Mr. Don Walker, and he could not join us this morning, so I know I've got big shoes to fill, and hopefully we can make this meeting very productive. As we talked about many times, these meetings are extremely important so we as the county government can get information out to you, the citizens, so you can make informed decisions for yourselves and your loved ones as we combat this virus and this pandemic. So again, thank you for joining us today, and I hope this session will be very informative. We've got some special guests here today that we'll introduce here in a second, and we'll take it from there. So when you get older, you can't see as well as I could when I was younger. So joining us this morning is Mr. John Davis. He is the Community Health Director for the Florida Department of Health here in Brevard County. Mr. John Scott, my favorite Director of Emergency Management here for Brevard County, and he leads us in the emergency management functions. Last week, we had a representative join us from Health First, and this week, we have Dr. Robert Beatty. Did I pronounce that right, Doc? Awesome. He's an ER physician from the Stewart Health Group here in Rockledge. And also joining us, as she does every week and just provides tremendous support for these functions, is our very own and fantabulous Miss Jessie Ray. She's our social media specialist, and she'll be monitoring today's program for any questions that we may receive from the media and our viewing audience, and we'll work to address those questions when we get to the end of our updates. And with that said, we'd like to start the update with Mr. John Davis from the Florida Department of Health. And Mr. John, sir, all yours.
Okay, thank you. Good morning. So another week, another record. We're at the highest rate of infection we've seen so far during this pandemic. Last week, we were over 8,000 cases. So that equated to a little bit over 1,300 cases per 100,000 of our population. This week, based on our numbers, we're anticipating that number will rise. I'm thinking somewhere around 1,900 per 100,000, which would put us above a 30% positivity rate. Those should be available at the end of the day today. Having said that, I mean, those are scary numbers, but at the same time, I will say that over the last 2 days, we have experienced a slight dip in our daily case rate. And then when you look at some of the other data that's out there, particularly the Cape Canaveral sewage viral monitoring, that's dropped by half from when they last looked at it at the end of the year. We're seeing similar reports of that same finding in other East Coast cities such as Boston. New York City's seeing a drop in cases. So I'm hopeful that we're reaching the peak. Next week will be very telling, but early indications are we may have gotten there. That would put us in line with what South Africa experienced. They reached their peak about a month after they started seeing increases in caseloads, and we're right at that point right now. So I'm cautiously optimistic that we're close to that point, and hopefully we have a quick drop off after that peak. In terms of deaths, we thankfully have not seen an increase in our death rates. They're certainly well below what we saw during the Delta surge, so we're very thankful for that. Hospitalizations, they've seen an increase across the board, particularly in the last week. However, again, with a more seemingly mild virus than Delta, the Omicron, the level of care has been more at the med-surg level rather than the ICUs. However, most of our healthcare facilities are struggling with staffing issues, due to folks out with COVID. So those two things combined are definitely putting a strain on our healthcare system. The same is true for our long-term care facilities. We are seeing some outbreaks increase there, and they're experiencing staffing shortage as well. So that's certainly a priority for us, is monitoring those outbreaks in those high-risk congregational settings. In terms of vaccination, we did increase very slightly, but at least it's an increase. So we went up 1 percentage point. So at this point, we're at 69% coverage of our vaccine eligible population, so those 5 and over. A little bit more of a breakdown on that. So our preteens, they're at 16% Vaccination coverage, our teens are at 50%. About 25% of our population has been boosted. So again, we certainly encourage folks that aren't vaccinated to seek vaccination. Those that have received their initial series of vaccine, we encourage you to get the booster dose. Certainly, again, the message we keep hammering and that we've hammered since the very beginning of this thing is those common sense measures that we know that work. Vaccination, masking in public indoor places, as well as social distancing, hygiene. Again, if you're sick, stay home, monitor yourself, and don't get yourself out in a public setting if you're symptomatic. In regards to schools, again, they're a reflection of our community, so certainly they've seen a tremendous increase in cases. And again, the same thing holds there. We would encourage school-age kids, of course, those 5 and over, to be vaccinated. And again, if parents, if your children are sick, certainly keep them home from school. That's about all I have. The testing continues with our health department as well as various places throughout the county. That information is available online at our site as well as the county EM site. 211 Brevard has that information as well. Our vaccination clinic is open, so we encourage folks to come by. They're open daily, Monday through Friday. And of course, many other places throughout the community are offering vaccination. So again, it's not hard to find, and there's really no lines at this point. So we, again, encourage folks to come in and get vaccinated.
Awesome. Thank you, John, for that update. And I like the words that you use, cautiously optimistic, and I'll take that. So maybe we're moving in a good direction, but we're not there yet. So we move on to the most awesome director of Brevard County Emergency Management. I almost called you Dr. John Scott. Mr. John Scott, soon to be Dr. John Scott. He'll give us a brief update from emergency management. John?
Thank you, sir, and I'm far from a doctor, but I'm working on it. So again, my name's John Scott. I'm the Emergency Management Director for Brevard County. I'll hit on a couple things this morning. One, as you heard John talk about from the Health Department, testing continues to be widely available throughout the county. The good news here, last time we were here, we talked about wait times really being pretty high. A lot has been done from a process standpoint to improve some things, so we've been able to cut wait times at a lot of the sites that we've partnered with down pretty significantly. Still will be some waiting, but it's not going to be the 3 hours it once was. So that's really encouraging news. Again, we are continuing to see a high demand for testing, continuing to test a lot of people countywide. Just continue to go find those locations. We partnered with 2, one at the West Melbourne Field of Dreams, the other being at Rockledge City Center in Rockledge. We know that the health department's doing it. We know that Parish also partnered on it as well. So those locations are up there. And they're available for you to seek testing, as well as our pharmacies, our urgent care centers. I will also, just as a reminder, as you heard John articulate a little bit what we're hearing in the hospitals and what we'll hear from Dr. Beatty here in a minute, just remind folks, hospitals are not where you go to get tested. Hospitals are where you go when you're sick and you need treatment. They are not there to test you. We have other options for that. I'll also talk about the monoclonal antibody treatment that it continues to be available at Rockledge. I know there's continued frustration with the limited appointments that they have. Again, that's mostly driven, that is entirely driven by the high demand for those right now and the limited supply that exists for that across the country. So we ask that you continue to be patient, remind you that you need to be both COVID positive and make an appointment. There are no walk-ups for that. You make that appointment at the patientportalfl.com. The screen right there shows you how to do it, create an account. And then just be patient and continue to look for appointments as they become available. We ask that you work with us on that. You can understand that the demand is really driving the limitations on those things. And then lastly, I'll just say, and again, build on what John talked about when we come through. Let's use those good common sense measures we know works. We've got a cold front coming in this weekend, starting next week. We know that often drives folks, we'll see an increase in just regular sickness as well. So just out of caution, while we're still in this high Omicron increase, stay home if you're not feeling well. And if you can't stay home, you need to work, wear your face covering, keep distance from folks, and do all of those good common sense measures that we know are proven. Matt?
All right. Thank you, John Scott. We appreciate that update. We are extremely fortunate to be joined this morning by Dr. Robert Beatty, who is the ER physician at Stewart Health Group in Rockledge, to give us a perspective of, from a hospital standpoint and from an ER standpoint, on how COVID is affecting us throughout Brevard County. So, Doctor, thank you for joining us this morning, and we really look forward to your words, and we'll turn it over to you. Thank you, sir.
Thank you. I think we can all agree that, the word unprecedented has probably been played out extensively in the media, but really, there's really no better word to describe what it is we're dealing with, not just on a local level, but on a nationwide level as well. To that end, we're seeing a lot of patients that are coming in with simply no ability to move through the hospital process due to the staffing shortages that were mentioned previously. And to that point, I'd also like to second John's comment about testing in the emergency department for COVID. There are readily available home tests that can be used, and they do not cause added strain to the healthcare system. Fortunately, with this go-round, we are seeing a lower acuity of patients, which is extremely helpful. It allows us to really render better care and allow people to go home in a safer and less infectious environment to, if you will, mend their wounds. We are seeing a much lower acuity, a much lower hospitalization rate, which is good news. We're also seeing a preponderance of infection in the younger population, typically patients in their 30s that have not received the vaccine. May give a subtle nod to the fact that the vaccine, while it does not completely prohibit the infection from spreading, does confer a fair amount of protection to the severity of the illness, which really helps the community at large as well. So to that point, anything that people can do to remain good citizens, to isolate when we have an illness at home or we have symptoms. If you feel the need to test, do so. But most importantly, mask up. Make sure that you keep yourself isolated using standard precautions. And I think we're showing signs that this trend, at least of this variant and this surge, is kind of on the waning end of things.
Awesome. Thank you so much, Doctor. We appreciate you being here, and thank you. Okay, so that's most all the inputs that we have from the panel. I'll turn it now over to Ms. Jessie Ray, our fantabulous social media expert, so we can address questions from the audience and concerns that y'all might have out there. Jessie?
Awesome. Thank you so much. So I'll start with some questions that we've gotten from the media prior to. So I'll start with, how many individuals at Stewart and Rockledge Regional are hospitalized? Do you have that number?
I don't have an exact number system-wide. I can tell you that in comparison to the prior variants and prior surges, it's a much lower percentage of the overall admission volume at the hospital. I would say the vast majority of COVID admissions, if we're looking strictly at COVID, are going to be low acuity, 1 or 2 night stays, usually in a med-surg or step-down unit.
Okay, so they're mostly in the step-down units. You don't. Do you know how many you might have in ICU or how many are inpatient?
System-wide, I don't have that exact data,
Sure.
but I could estimate it's probably upwards of a single-digit percentage compared to the overall hospital admissions.
Okay, great. And you kind of started to mention it. Do you know about how many hospitalized patients are vaccinated or unvaccinated, and how do you count vaccination status at Rockledge and Stewart Regional Hospitals?
So, our ability to count that data is probably not much different than any other healthcare facility that's out there. There are several different combinations of vaccination status, ranging from those that haven't been vaccinated to those that may have only had one of the 3 series shot, or those that had the Johnson & Johnson shot. So really the definition of vaccinated is tough to really kind of factor into the actual numbers. Overall, I can say that those that are coming in with a higher acuity of illness are those that have been unvaccinated. So that's probably the best data I can get you.
Okay. I guess this could be for DOH. How are the case counts being affected by the recent increase in testing? Or John? Either John.
Well, certainly, I mean, the more you test, the more you're going to find. But we also know that there's plenty more out there that, you know, so anytime we quote numbers, that's known positive results. So there's plenty more out there than that. And that's always the case with any disease. However, I think when you look across the spectrum, regardless of how many people are testing, you know, you see the increase in the healthcare setting, the increased outbreaks, the increased admissions. So it's just an indication that, you know, those numbers are truly up, regardless of how many you're testing in a day. Yeah.
Okay. John Scott, does the county still have a supply of the monoclonal antibody treatments?
Yeah. And just to help clarify that, so we partnered with a vendor, CDR Health, who's a private health provider. They're the ones who operate that, and they get that straight from the state. So it's not the county's treatments, but yes, there remains a supply. Again, I touched on the idea that it's limited. I've said that since we've been back with Omicron, as we know that demand nationwide has pushed that supply nationwide and continues to constrain our ability to offer as much as we offered during Delta. But yes, supply still remains. We are taking appointments, all those things.
Okay. Doctor, you kind of mentioned it when you were giving your update, but I did want to ask, since it came from Dave Berman, maybe you have something more to add. What differences are you seeing in the current surge in cases from the Omicron variant compared with the previous Delta, such as the severity, the symptoms, hospitalizations, deaths, that kind of thing? Was there any more you wanted to add?
So I would say that with the Delta variant, and the challenging part of this specific pandemic is the virus itself. The variants that were handed are really unpredictable, and they can range from extremely severe and extremely infectious to very minimally infectious and minimally severe. I would say that with this current surge, we're seeing a much lower acuity of the presumed current variant compared to Delta. The Omicron variant has borne out, at least in the South African studies and several other nations, to be a lower acuity type of variant, and we're seeing that as well. The transmissibility, however, is a different ballgame when compared to the Delta virus. The Delta variant at the time was also hitting us harder in a period where fewer people had been vaccinated. In fact, I think it probably encouraged a lot of people to get vaccinated, which may have contributed to some of the decreased presentation we're seeing with Omicron right now. So it's a combination of lower acuity, higher transmissibility, being blunted by the vaccinated public. So that's kind of where we are.
Okay, excellent. Thank you. And, you know, I know, John, from DOH, you said that we are cautiously optimistic, but Dave did ask, are you at all optimistic about the local outlook in light of the case counts having peaked in some other parts of the country and in some other nations, which, again, we have mentioned, or is it kind of too soon to tell? And do you want to add more to what you kind of said earlier in regards to that?
Well, again, you know, we look at what the trends are around the country, around the world. You know, we often look to Europe and certainly South Africa with the Omicron to kind of get a loose idea of what we might be looking at. Of course, you also have to consider that, you know, each population has a different set of morbidities, a different level of vaccination. One of the concerns was here, as opposed to South Africa, we have a much older population, a lot of comorbidities. So that was a big concern, that even if you're looking at a potentially milder a variant, you have a higher risk population and a bigger population. So you're just going to have increased numbers regardless, which that in and of itself puts a strain on the healthcare system. But a short answer to that is yes, I'm optimistic that some of the other data points in the community, like I pointed out, the wastewater viral load has gone down. I believe it was 50% from when they last tested. So that's a good indication that we're headed in the right direction. And again, you know, you look at the East Coast in general, and it looks like everybody's starting to trend the same way. Again, I'm reluctant to say we are at a peak today, but it's pointing to that. So I'm hopeful that that's indeed the case. We'll have a clearer picture certainly next week.
Okay, thank you. So Okay. How do we take all of these home tests into account of the data that we're giving, since they're not necessarily reported? You know, we report testing numbers, but we're not reporting those at-home tests. So are we influxing our data at all, or how are we doing that?
No, so again, any numbers that we're quoting are documented positive. So some of the tests, such as the Binex home test, the app does report that. So some home tests are reported, some aren't. So those that aren't, we wouldn't necessarily have that in our database. I mean, of course, if a facility is using those tests, we as a health department would get a call from that facility that they have positives and act on that. But in terms of showing up in the data, not necessarily, unless that's sent to us with all the information on the positive, then it can be loaded. But again, a certain percentage of home tests do have that capability, and they will upload into a system that reports directly into our tracking system.
Okay. And so kind of speaking about the at-home tests, I think most of us know about the recent at-home tests that the president put into effect. How are people supposed to go about getting those tests? John, can you?
Yeah, I'll take that one. Again, we know there's been a lot in the media out there as far as when that's going. We know the president's talked about it several times. I think most recently he said there will be a website that comes online sometime next week. Obviously, as soon as that information is out there, we will share it far and wide. Today, that's not something that someone can request. We're optimistic that that's going to be an option for folks next week. You know, feds tend to move a little slow on things, so could be 2 weeks, but I know the president's goal is January.
Okay, awesome. So the appropriate masks to wear has gotten a little bit confusing over, the last several months. Can any of you provide any information or simplify what should people be purchasing and where?
Well, I did hear a quote in the media, and I liked it. It was from Dr. Job, who is up at Brown University and is on the news quite a bit. And it comes down to, and I think he's right when he says that the best mask is one you're going to wear all day. I mean, that's the bottom line. Certainly, N95s are going to be more effective than a cloth mask. However, a cloth mask is effective. And it more comes down to wearing it properly. That's the biggest message. I mean, we can get into studies on which one might be a little bit more effective than the other, but the bottom line is wear it in the appropriate settings.
Okay. Doctor, did you have anything to add that you wanted to?
So I kind of second that as well. I mean, N95s are going to obviously provide superior protection, not just for the person wearing the mask, but more importantly for those that aren't. It should be noted that a proper N95 requires a fitting, requires sealing, requires really verification that it is actually not allowing any particles in or out. But to that point, any barrier that reduces the transmission of the virus and decreases the trajectory of the virus on exhalation really is going to be best served by whatever's consistently worn.
Okay. And also to that, like you said, we can go get those type of masks. There's a lot of frauds out there, such as Amazon and things like that. Any recommendations as to where people should be purchasing these masks, like maybe Home Depot or Lowe's or anything?
Not really,
Okay.
to be honest with you. I mean, ironically, painters' masks do just as adequate of a protection as a low-level N95. So as long as you have decent protection, and again, consistently wearing it, and appropriately isolating yourself from other people, really it's a combination of behavior, not just one specific barrier to transmission, that overall provides the effective reduction in transmission.
Right. And I think that's one thing we've been talking about a lot ever since we started this, is it's not just one mitigation factor. It is all of them combined are what's going to help us, mitigate this, not even just stop it, but reduce. So a couple of people are asking, and I don't know that we're going to have a definite answer, but I do want to put it out there. Is a test required before taking a flight or taking a cruise? And it probably depends on the provider. But
I'll take it. And the short answer, Jesse, is what you think, which is it depends on where you're going, what the carrier requires, what the provider requires. Domestic travel on a plane doesn't currently require a test. Foreign travel typically does, depends on that country you're going to. Best advice is if you're going somewhere, just like you would, when you're making plans to pack and who's going to pick up the mail and all those kinds of things, also do research on what's required to get into wherever it is you're traveling to. And a reminder, if you are traveling domestically, you are required to wear a face covering.
on your flight, that is correct. Okay, I did have one thing that I wanted to point out in the comments that somebody said they don't read your comments. And you're right, we don't read your comments, but we do read your questions. And so I did want to just solidify that. But that's all the questions that we have for today, Matt. So back to you.
Thank you, Jesse. And that kind of wraps it up for our weekly update today. I'd like to thank all of Brevard County who is tuning into this. Thank you for sharing a 30 minutes with us this morning so we can get that information out to you so you can make appropriate and good decisions for yourself and for your families. Brevard County government, that is one of our sole purposes, is information and support to the community. So this is part of that vehicle that we use to provide information and support the community. So thank you for tuning in for this. I'd also like to big shout out to Dr. Beatty. Thank you for joining us, sir. We really appreciate you being on the panel. Big thank you to John and Jesse and the man behind the scenes upstairs, Logan. Those four folks have been working their tails off for a better part of 2.5 years now to make these Facebooks go, to get the information out, to work hard, to just do everything. There's a tremendous logistical effort to make these things happen. And they're kind of the folks behind the scenes, and they don't get a lot of thank yous and a lot of recognition from time to time. So I'd like to take 1 second to thank John, Jesse, Logan. Thank you guys. And Dawn Walker, who's not here today. Thank you guys for making this happen, because it is tremendously important that we get this information out. And I know as a Brevard County citizen and taxpayer, I appreciate you guys as part of my county government. So y'all have a great weekend. Thank you again, Brevard County, for tuning in. Please be safe out there. Please use the information that we've presented to make those good decisions. And we will see you again next week. Next week, we're going to have a little bit of a different time. We're going to be starting at about 2 p.m. in the afternoon. So be looking on our social media and our everything that we advertise for this session. Again, it'll be starting about 2 o'clock in the afternoon, 2 p.m. next Friday for our next weekly COVID update. Y'all have a great weekend. And again, thank you for tuning in.